Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Good afternoon. Welcome to Health Talk. My name is Hallie Fields, and I'm your host today as we talk about health, how to get it, and how to keep it. With me today is Dr. Scott Luper. Dr. Luper is a naturopathic doctor, and today we are talking about how to get healthy. Hello, Dr. Luper. How are you?
Hello, Haley. I'm doing good.
Good. Glad to hear. In continuing our Living Well series and going forward, I think that something important to touch on today would be prostate disease and prostate health.
Yeah, last week we did kidneys, and this is kind of a logical next step is to talk about prostate. It's part of that whole urinary tract thing, and it's a real problem for men, particularly as they get older. And, you know, so much is not understood about prostates or misunderstood. And so I'm really excited to be able to teach our listeners about prostates, what they do and how to fix it. We should just start out the big picture here, which is what's a prostate?
What's a prostate?
Why do we even have one?
What is a prostate? What does it do? You'd be educating me, as I know very little on the subject.
Yeah, so what the prostate does, first let me tell you where it is. It's a kind of a fat walnut-shaped blob that sits just inside you along the urethra. And what it does is it makes fluid.
Okay.
And so there's in the manufacture of ejaculate, your testes make sperm,
Mm-hmm.
right? But it doesn't have a lot of fluid associated with it. So what the prostate does is it makes this juice, if you will, that makes it more likely for the sperm to be effective.
Oh,
so
okay.
it helps you get your partner pregnant.
Sure.
That's really what it does.
It's the vehicle
that's it.
Of the sperm.
That's it. So what it does is it makes a certain pH, because the sperm's got to survive going through the vagina. This is like, we're on the radio. Can we do all this? I think we can.
It's medical. It's medical.
Okay,
People can put on their grown-up hats for just 30 minutes.
Good. Very good. So what happens is the vagina is not a conducive environment for sperm. Oddly enough, you think it would be, but it's not. It's too acidic. Mm-hmm. So that you got to fight that acid, and the prostate is the main organ responsible for creating this basic fluid. Basic as in it's got a pH that's opposite of acid. That's conducive to the proper functioning of sperm, so they could swim hard,
Mm-hmm.
do what they need to do. That's it. That's what it's there for.
Wow.
Pure and simple. That's what it does. And it's super important because if you didn't have a prostate, well, you couldn't have kids, at least not the old-fashioned way.
Right.
Okay? Now, the whole prostate thing is real sensitive to hormones because the whole reproductive thing is real sensitive to hormones, right? So it's part and parcel. When your hormones are running hot and heavy, then your prostate is fully engaged, right?
So
it's doing
if
its job
your
well.
hormones are low,
then it doesn't work correctly. Now, here's the weird thing. First, I tell you, if a prostate goes bad, let me talk about that first. When the prostate goes bad, it creates a real problem because this prostate sits right around the urethra. That's the tube that you pee through. Mm-hmm. And so now you got this hunk of tissue that's a little puffy. It's grown more than it should be. It's called hyperplasia. You got more cells there. And so now you got a pinch point. Okay. And you got to pee through that pinch point. Now, if your bladder's pretty strong, though, it could squeeze hard.
is it uncomfortable?
No, yeah, eventually, but not really. At the beginning, it's not uncomfortable. It's just that your bladder squeezes best when it's full. Mm-hmm. And when it gets empty, it just doesn't squeeze as hard. It's harder for it to squeeze all the way down to nothing. So what you get is some remainder. So you empty your bladder, except for it's not empty. You got a remainder. You got some urine that's retained inside you, which is not much of a problem. Doesn't hurt, doesn't cause any problem, really. I guess you get the occasional stone, but mostly it doesn't cause any problem, except you don't have as much space to fill up as you did because it's already partly full. So instead of, being able to go the whole night while you're sleeping and then just have to get a full bladder and empty it in the morning, you're going to have to empty it in the middle of the night.
Yeah.
You got to get up now.
Frequent waking would be a sign of a...
Well, I'd say having to get up to urinate. Just waking up's not enough. You got to wake up and you got to go, you got to go pee. And if you do that once, it's like, that happens. You drink an extra glass of water before you go to bed. Occasionally people get that. But there's some people that their bladders are so full that when they go, they're hardly emptying anything, and they're having to get up 4 or 5 times a night. Oh. And at this point, it's wrecking your sleep.
Yeah.
And now you're suffering.
Yeah.
Now you're dopey, your blood pressure's up, your blood sugars are high, your life's going to hell in a handbasket based on your prostate. So it is definitely a problem. So now the question is going to come up, why does the prostate grow? Now we know that the prostate's sensitive to hormones, and we know it's sensitive to testosterone.
Sure.
Right?
Yeah.
So that's how it works, right?
Yeah.
So you think, well, as I get older, my testosterone levels go down, my prostate should shrink. No. Opposite. It doesn't shrink. What happens is testosterone is a prostate stimulant, but it doesn't stimulate the growth of the prostate. What it does is stimulate the function of the prostate. Now, testosterone can convert into another stronger hormone. It's called dihydrotestosterone, or DHT. We'll just call it DHT. So DHT definitely stimulates the prostate. But the tricky thing about DHT is I'm going to go slow on this one because I want you to understand this part. It's real important. DHT is concentrated in the prostate mostly by estrogen.
Oh.
Now, isn't that weird?
A little.
Estrogen is a female hormone. What the heck's it doing in the prostate, right? Prostate's a male organ. No. All of our body is sensitive to both estrogen and testosterone. We have receptors for both. All women have testosterone receptors. All men have estrogen receptors. It's just a matter of balance. Women have the estrogen higher, testosterone lower, vice versa for men. So if the estrogen levels are relatively higher, that is, testosterone levels go down, but the estrogen lingers. It doesn't go down as much or at all. Now you have a perfect environment for growing your prostate because the estrogen will block the reabsorption of that dihydrotestosterone, the DHT. It also tends to promote the conversion of what little testosterone you have into DHT. So estrogen turns out to be the main problem. Not DHT. I mean, right, DHT is the thing that's doing it. Yeah, that's right. But DHT is dependent on what the estrogen is doing. That's why it goes high. It's because of the estrogen. So now you're thinking, whoa, this is interesting. This is different. I went to go talk to my urologist. He didn't say anything about estrogen. You're right, because they don't think about it that way. But everything I'm telling you is 100% true. Absolutely. Now, okay, what does this really mean in real life? How can you use this information to help you? Now, let me ask you a question, because you know this. As you get older, what part of your body, as a woman or a man, makes the most estrogen?
Is it the adrenal?
Some,
Okay.
not the most.
The hypothalamus?
No, you're fat.
Oh.
Isn't that interesting?
Very.
Fat is an endocrine organ. Fat makes hormones, particularly estrogen. It does.
Yeah, that makes sense.
Now, you think about the way our society has grown plumper. We generally have more fat than we used to in the olden days.
So people are producing more estrogen.
They are. You think about what happened to the little girls who you used to get their period, back in the old days when they were 16.
Right, but
and then
now
it was 14.
It's like
Then it was 12, and then it's 11.
And 9.
Yes.
Yeah.
Why is that? Because of fat.
Because of fat.
Because these little girls are making more estrogen in their fat, and it's causing them to have periods earlier. Also, breast cancer. The breast cancer rates have gone up and up and up and up and up. Why is that? Yeah. One of the contributing factors is estrogen. Now, there's complexity to this because women who have a pear shape tend not to get breast cancer. Women who have an apple shape tend to get breast cancer. It's not just the estrogen. There's other stuff as well. But holy moly, the show will never end if we put layer and layer and layer stuff in.
So let's
we're getting
stay on the track.
We're getting sidetracked. Let's go back to the prostate. Part. Yeah, so the dealio with prostate is if your estrogen levels are too high, you're going to grow your prostate. Okay. So the game is how do you get your prostate to shrink is you need to reduce your estrogen. How do you do that? You lose weight. The number one most effective treatment for a benign prostatic hypertrophy, BPH, is to lose weight. And seriously.
That's by eating right and exercising.
Yeah, back to eating right and exercise. Every show we've ever done ever in 14 years has been about eat right and exercise. And we're back to it again today, right on schedule. This losing weight thing. Now, this is good news and bad news because, hey, how interesting. You mean I could lose weight and get my prostate to shrink? Yeah.
Okay, so say John Doe comes in, loses the recommended 30 pounds, and he still has high estrogen levels.
Well, now we got to figure out where the estrogen's coming from. You're right. It's possible you could have estrogen coming from someplace else. It may be that your adrenal glands are hyperproducing estrogen or something. But those are weird cases. You hear hoofbeats, chances are it's a horse. Mm-hmm. It's not a zebra. You just talked about a zebra. That's a zebra. They do occur. They are in real life. There are zebras. But the vast majority of hoofing sounds are coming from horses in this country. So the estrogen is coming from fat mostly. You lose weight and your estrogen levels come down and you feel better for it. A lot of times, actually, what gets in the way is people take different kinds of medications that screw with your hormones, and that ends up messing it up. Now, let's talk about this is very helpful. Thank you, Dr. Luper. But, losing weight's easier said than done, right? I tried to lose weight. I couldn't do it. Now what? Am I stuck with this prostate? Don't they make a drug to be able to fix this? And the answer is they do. Finasteride is a medication that will block the formation of DHT.
Okay.
Which is nice. It's nice to be able to do it. Proscar is what it's called. And so you can take Proscar and you can actually shrink your prostate some. It does have some side effects. The DHT, it turns out it was not just only growing your prostate. It was doing other things too. So your chances of getting an erectile dysfunction runs around 5%. That's not bad. 95% of men don't have any erectile dysfunction and 5% do. Now, is there any alternative? Yeah.
Yeah. Tell us some of the alternatives.
One of them is saw palmetto. Saw palmetto really does about the same thing. What it does is it blocks the conversion of testosterone into DHT. It also acts as an antioxidant, has some other stuff to it. We're not exactly sure all the details of what it does. Clearly, it's a hormone blocker. That much we know for sure. And the chances of you getting erectile dysfunction runs around 1%. So it's about 5 times less erectile dysfunction than the Proscar does. And here's the other thing, too. It's not the only thing you could take. There's a zillion things you could take. Let me go over the short list of stuff that's good for...
Before you go over that list, I just want to reintroduce ourselves to people who are jumping on the show late. This is Hallie Fields, Director of White Spruce Medical, sitting down with Dr. Scott Luper, and we are talking about prostate health today.
Yeah. So prostate health. We kind of skipped over a section that I want to, let me kind of review this a little bit for people who just joined us, and also for people who've been listening the whole time. Let me get into it a little bit more, which is what are the symptoms of an enlarged prostate? So remember, the prostate straddles your urethra. That's the tube that you pee out of, and it creates a pinch point. It squeezes it tight. And so if that pinch point is strong enough, your bladder has a hard time squeezing the urine out. So what you end up getting in a situation like that is a very weak urine stream. So one of the ways that you can check how someone's prostate is functioning, how big it is and how strong your bladder is by doing a the strength of your pee test. Your urologist has a way of checking this. And there's a machine that can literally check the force of your urine stream. There's another way to do this at home. What you do is, well, I don't know if your wife's going to like it. You go out to the driveway and you go to the snowbank and you see how far you can pee.
Oh, okay.
And you could just measure from the tip of your foot out to how far you can pee, and you'll know exactly what your urine stream is. That is an absolutely valid test, 100%.
Okay.
So if you have it really bad, you can't pee further than the end of your toes.
Oh.
It's just the urine stream just goes straight down. It doesn't go arc at all. It doesn't go anywhere. And if you have some degree of inhibition from your prostate, then it will inhibit the arc and how far you can pee. You could pee a foot or 2 feet or 3 feet or 5 feet. I mean, if more than that, you're going for the record.
Okay.
So youngsters, yeah, they can, no problem.
Okay.
They could just send it out there. Us older men remember the day, right? When you could just let it go. Anyways, I've got to be careful. This is a radio. We have to be nice. So that you can get a sense of it, and that's one of the ways it shows up. So what you're trying to do when you're treating your prostate is to get it to where you can pee further. That's how you can tell if you're doing it correctly. So if you're doing it correctly, then and your prostate shrinking, you can go out to the yard again and pee into the snowbank and check and see what your progress is. Look, I got it another 6 inches. Sweet. I'm getting better. You can check yourself how it's going, right? The other thing that happens is since your bladder isn't emptying all the way, it keeps you getting up at night because your bladder is basically functionally it's tiny.
Right.
Because it's all full of urine all the time.
Urinating frequently.
Yeah. So that's another way you could tell. Instead of getting up at 4 times a night, you only get up 3 times a night or 2 times a night, or maybe you get to the point where you can go the whole night and stay asleep and never have to get up once. Yeah, that's kind of pie in the sky. Once you get a prostate that is hypertrophied, that means it's grown more cells, it's really hard to bring it back to normal. The fact that you can't. It just doesn't happen. I've never seen anybody bring it back to normal. What you can do is dial it back from the peak. That's a realistic goal. That can be done. To bring it back to normal can't be done. So sometimes, due to genetics or due to the situation or due to someone's weight or whatever, that there's, even though you do everything possible, you do the herbs and the drugs and just the whole lock, stock, and barrel, you literally can't get your prostate to shrink enough to where your quality of life isn't seriously impacted. And that's a situation where you actually need to get that prostate altered.
Okay.
Now, what you can do, there's a number of different kinds of procedures and surgeries. Dr. Nema does a thing called a urolift, where they actually lift the urethra away from the center and pull it out with these little staples. It sounds horrific, but it's I know it's not. It's sometimes an alternative to doing other worse things. Sometimes it's extremely effective. And you just create a little space there, and now your problem's solved. Everything's hunky-dory. It doesn't always work. It doesn't always take. The alignment of the staples is real important. How they pull on the tissue is real important. There's a lot of different things to do to get it to go just right. And if you get it just right, it's fabulous. It is the cure for your problem.
You say that's the solve-all, but is there risk of the prostate continuing to grow?
Yes, there is. It's a stopgap is what it is.
Okay, it's just...
Now, here's the thing. Something's going to get you at some point. So, if it takes 20 years for it to grow to the point where it's a problem, I mean, seriously, what chance are you making another 20 years? Not zero, but it's, the chances go down. So it may just be all you need. In some situations, it just doesn't work. It just won't do what it's supposed to do. It just literally, the alignment's not right. It doesn't open up the urethra it's supposed to. So what do you do in that situation? Well, they got this surgery where they go through and they basically take a core right out of the middle of the prostate and open that tunnel up. It's called a transurethral resection prostate thing. TURP is what it comes out to. It's a terp, and you can get a terp, and that'll open you up nicely. Now, the terp is absolutely fantastic, except for it's going to take a while to heal up from it. And so it's it's painful, but they knock you out. I mean, it's surgery, right?
Right.
But it takes a while to recover, to basically have the scar tissue go and grow in such a way that you can be able to pee through and get everything to work well. What they have to do is they have to run a plastic tube through there for a while that allows you to heal without having the urine irritated. It's called a catheter. You have to be catheterized for a while. So it's no small thing. It really isn't. It's better, way better, ultimately better to prevent this problem and catch it early and do a variety of things. So let's talk about that.
Yeah, you had mentioned a medication that helps shrink the prostate. Are there any natural supplements, herbs?
There are. Now, anything for it to work, what you're going to have to do is you're going to have to restore a balance to the testosterone and the estrogen. As we get older, our testosterone goes down, and our testosterone actually protects our prostate by balancing out the estrogen. Remember, the estrogen is what's causing problems. So if the estrogen gets relatively high, that is, the testosterone comes down, but the estrogen doesn't come down at all or little, then effectively you have more, I'm using air quotes here, estrogen, and you get the problem from it. So if you can figure out a way to block the effects of that estrogen or just to lower estrogen, then you're going to get improvements over this. So how do we do that? Well, there turns out to be a bunch of herbs that are helpful. The first one's called saw palmetto. Serenoa repens is what it's called. And saw palmetto, which is called that. And saw palmetto is effective. They've done a bunch of research on it, and it works. It really does. It's up there with proscar in terms of its ability to solve the problem. There's other things as well. There's this African tree called pygeum, and pygeum does a similar thing. It's not quite as effective as the saw palmetto, but the weird thing is every once in a while, somebody is just more sensitive to the pygeum. It just works better. It shouldn't necessarily, but it does. We're all different. So some people do better with the pygeum. Now, there's another thing. It's nettle root.
Oh.
Nettles.
Right.
They grow in southern Alaska, and they grow in the Northwest. You walk by them, and they sting you, right? That plant, it's the root. You actually pull the plant up, and you make a medicine out of the root. That also blocks hormones, and it's also effective. Now, again, it's not as good as the saw palmetto, except for when it's better occasionally. So people do better with it. So if you buy, like you go to the health food store or the grocery store, and you buy, or even our clinic, and you buy something for your prostate, most of the time, at least in the stuff that we carry, has the saw palmetto and the pygeum and the nettle root. Okay. All three of them. Okay. Because what we're doing at the clinic is we're hedging our bets.
Right.
We're hoping to one of the three.
Trying to take them from all angles.
Yeah, and there's some other stuff that's helpful too. Turns out amino acids are helpful with this.
Oh, interesting.
The key one's glycine, but alanine is also helpful. And so if you put some glycine and some alanine in the formula, you can get it to work better. There's also other more effective hormone blockers. I don't know, more effective is the right word. Is effective in a different way, hormone blockers. Here's one that's interesting, and you wouldn't think that it would be one that would work, and yet it does. And that is soy.
Uh-huh.
I know this is a hard sell because men just tend not to want to eat soy, because it's got a lot of phytoestrogens in it. And it's the kind of thing, if you got a prostate, you should just avoid soy, right? Because it's common sense. It's got this estrogen stuff in it. It's going to grow my prostate, except for it doesn't. What the phytoestrogens do is they're like estrogens. They interact with the estrogen receptors, but they do so weakly. That is in a weak fashion.
Right.
And so what they effectively doing is they're blocking estrogen.
Huh.
That's what they're doing, blocking estrogen. They're estrogen blockers is what they are. So soy products are estrogen blockers. So if you did lots of soy stuff, and the most powerful soy is not tofu, it's not soy milk. Those are relatively weak. The most powerful soy is soybeans. Yes.
Edamame.
Yeah, which are slightly underripe soybeans is what they are.
Okay.
They're green soybeans. Right before they're finished ripening all the way, they pick them early, and steam them up and eat them. You pour some salt on them.
Delicious.
They're fabulous. They're super tasty. And they're good. They're good for lowering your estrogen levels. Now, again, lowering, it's not that they lower any kind of estrogen. Your estrogen doesn't go down low. What happens is they block up the estrogen receptors. Since they have these phytoestrogens in them, the phytoestrogens attach to your estrogen receptors. And now your estrogen receptor is attached. It can't interact with estrogen. Estrogen bounces off. It won't attach. It's already full up. And so the estrogen can't do anything. Literally will not do its job. It cannot stimulate you because you're being blocked by this phytoestrogen that's weak.
Okay.
And so it doesn't wreak near the havoc. So in effect, in functional effect, you have lowered your estrogen levels. So if your testosterone's coming down and you do soy, you're effectively lowering your estrogen. It goes against common sense.
It does.
But it's just how it works. This is reality of it. What an interesting show we have here, isn't it?
That is very curious. Very curious.
I'm a little on the technical side right now, I'm sorry, but I'm trying to really boil it down so y'all can understand it. Turns out your prostate's sensitive to estrogen. If you can block estrogen, then you're going to save your prostate from growing. It won't grow. Now, the mechanism is testosterone gets converted into dihydrotestosterone, DHT, but estrogen is instrumental for this. I'm hoping doctors are listening to this so they can learn something about how this all works. 'Cause I talk to doctors all the time, and almost no one knows this.
Wow.
They're not aware of this thing. And again, this is just, it's out of the book. It's not like it's hidden. It's right there for us to utilize. Now, again, the single most effective treatment for prostate that I've ever done is for a man to lose weight. Is they eat a diet that balances their blood sugars. They exercise a whole bunch. That'll get your testosterone levels to go up again and balance the equation. They avoid excessive carbohydrates. They eat lots of fiber. They get plenty of protein. They get super healthy. They get strong. Their hormones get balanced. Their prostate shrinks, and they are profoundly better. For real, all the way better. And so it's just fabulous to see that happen. It takes someone who's really dedicated to living well, to be able to see the bigger picture, to be able to change their chemistry such that their body literally is changed and it's functioning better. Yeah, that's an impressive thing when it comes along. Not everybody's capable of doing it, but I'm rather encouraging for that.
Yeah, absolutely. So,
I got the vision. I seen it happen before, and so I could say, I saw that. I know what it looks like. Here's what you do. You do this, 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 and this. And then we could see everything go in the right direction. The other thing I do, and this goes without saying, is I run a whole bunch of tests to be able to figure out what people's hormones are, and I'll look at their estrogens. There's not just one estrogen. There's 3 estrogens. The estrogen number 2 is the one that's the most powerful. We have to watch that one the most. But the other ones are players as well. There's other hormones as well, other male hormones that we want to keep our eye on, and DHEA and so on and so forth. There's a whole bunch of hormone stuff. I'm leaving a lot of details out of this. But there's a whole bunch of hormone stuff that if we look at, we can really help dial the hormones in better and get the prostate to shrink, to some extent. Now, again, I don't want to give everybody the wrong impression. You can't fix every single case of prostate hypertrophy. Some people are just too far gone. And if that's the case, I'll let you know. Remember, we do the pee test.
Yeah.
That's how you can tell. You pee, and if we do the whole treatment and you can't pee any further and you're still getting up, 4 times a night, well, we gave it the old college try. You're going to have to get some other kind of more mechanical treatment to be able to turn this thing around.
Wonderful. If we have any listeners out there who need some additional motivation in improving their prostate health, then how can they schedule with you?
Yeah. Before we do that, there's one other thing I want to mention is that, a lot of times the solution to pollution is dilution. Oh. If you can have a prostate that drains, right? If you literally, the fluid in it doesn't just sit there, but it empties out on a regular basis, that's good for your health. So it turns out to be helpful to engage in sex.
Yeah.
It turns out to be good for your prostate.
For a number of reasons.
That's right. So I just had to throw that in too. It's common sense.
Yeah.
Yeah, like that.
Wonderful. Thank you again so much for all of your insight and your knowledge. Thank you for tuning in today. Hopefully we'll see you next week. Stay safe, stay healthy, and stay in touch.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.